Ruben, how you doing today?
Well, I'm doing just great, doctor.
That's
Real
good.
great.
Better than you were
A lot
weeks
better.
ago. Yeah.
A lot better, yes.
So let's just so I did an INSPAN on Ruben here, and we put this device in it at L4-5, and but I just want to go over his symptoms before. So when you first came to see me, you were in pretty bad shape, weren't you?
I'm pretty bad shape, yes.
You could hardly walk, hardly
I could-
stand.
Could hardly walk or even stand on there.
You couldn't even walk 20 feet.
No.
And you were
No,
dependent
not at
on
all.
the cane.
Yes.
You couldn't stand, and
Right.
I mean, life must have been pretty miserable.
It was miserable on there, and
You
I
said you
think-
were kind of like stuck to your recliner.
Yes, yes, and like I just had a lot of thoughts that I didn't have no urges to even stand up or do anything.
You had no energy, you had no drive,
energy at
no,
all. Especially the
no
drive.
hope. Basically,
Yeah.
no hope. Right?
Yeah.
It really affected
Yes.
your whole outlook.
Yes.
And you had seen a surgeon, and he talked about very big surgery.
Oh yes, he talked things in there. He explained to me things that I did not like the way he described it.
Oh, major surgery, and he would have had to have 3 surgical levels fixed in order to get the worst level. But
Yeah.
he has some problems at other levels, and the surgeon can't just go in and fix one level.
Well,
He's got to
yeah.
fix it all, and then that's going to
Yeah.
cause other problems. So,
Well, I know one thing. The surgeon that explained this to me prior to his visit that day, I had there was a patient, and he was there, and to see the same surgeon, and he was saying, "Well, I feel a lot better on my neck and all that," but that was his neck.
right, sure.
And but yet I said, well, maybe I want to listen to him. But when he described it to me in his office in there, it did not
It's
sound
big- it was big
anything
sound
like
in
the
the
way
hospital.
he was sound.
But we were able to. Now he had severe stenosis, and he had slip. He had some listhesis,
That's right.
and it was really choking off his spinal canal. And but I told him there was another way, a minimally invasive way to put this spacer in. And what the spacer does is that it lifts on the back of the spinal canal. It lifts this up, and it opens up where the nerves exit, and it opens up in the spinal canal. And this spacer has teeth, and it locks it open. It locks in that open position, so it opens up the whole canal. And so this was like just 2 weeks ago we did it, and
Oh, yes.
you knew the next day.
Yeah, I knew the
That he
next
was so
day
much
that
better.
an improvement was done. And
Almost immediately, right.
yes, and I said right there, then I made the right decision at that
And
point.
now you can walk, and you said you don't
Oh,
use the
yeah.
cane, it's for balance, it's not,
For
he's not
balance
totally
issues.
dependent on it.
Yes, that's right.
And so he's doing markedly better, he can stand longer, he can walk longer, he feels better, now his get up and go, which had gotten up and went,
Oh,
is now back.
Yes.
He's excited about getting up and moving around,
Oh,
and
definitely.
he can see a brighter future, which is amazing. So,
Mhm.
you know, he's 2 weeks post-op. We're going to start physical therapy another 2 weeks, and then he's getting stronger and stronger. And you know, there's a lot of good things to come. So,
Well, a lot of things, and I like to hear that. And I think, Doctor, from that procedure that I had from you I'm pretty sure that you can help me out as well with my balance issues as well.
no, you're going to do that on your own. You're going to have to do
Yeah.
physical therapy. But
Yeah.
yeah, pleasure taking care of you. Thank you for having
Doctor.
confidence
Thank
in
you.
us. And I'm glad you shared your story so other
Thank you,
people can
Doctor.
hear it and can benefit from and
Thank
give them a
you.
little insight. So thank you so much.
Thank you.